Bismillahirrahmanirrahim. Assalamu alaikum everyone. So today's video is on what is haemophilia. This is a rare disorder in which the blood doesn't clot in a normal way because it doesn't have enough clotting factors, also known as clotting proteins. So if you do have haemophilia, you can bleed for a longer time after an injury than you would if your blood clotted properly. So usually small cuts aren't a problem, but if you have a severe form of haemophilia, mainly what the concern is that bleeding inside your body, especially in your knees, ankles and elbows. And this internal bleeding can damage your organs and tissues and is always life-threatening. This is almost always a genetic condition, and treatment includes regular replacement of a specific clotting factor that is exists. Depending on how severe your haemophilia is, your symptoms can vary depending on your clotting factors. So if your clotting factor is mildly reduced, you can bleed only after surgery or trauma. If its deficiency is severe, you can bleed easily for no reason. So here on the screen you can see the signs are unexplained excessive bleeding from cuts or injuries after surgery or dental work, many large or deep bruises, unusual bleeding after vaccinations, pain, swelling or tightness in your joints, blood in your urine or stool, unknown nosebleeds causes, and unexplained irritability in children. So a simple bump on the head can cause bleeding into the brain for some people who have got severe haemophilia. This is very rare, but it is one of the most serious complications that can occur. So signs of this include a painful and very long headache, repeated vomiting, lethargy, sleepiness, if you get double vision, sudden weakness, clumsiness, and seizures. Here are a list of complications: deep internal bleeding, bleeding into the throat or neck, damage to your joints, infections, and an adverse reaction to clotting factor treatment. For diagnosis, you can have clotting factor tests, which can reveal a clotting factor deficiency and determine how severe the haemophilia is. Or you can use genetic testing, which might be used to identify carriers to make informed decisions about becoming pregnant. So for severe haemophilia, the main treatment involves replacing the clotting factor you need through a tube and a vein. This replacement therapy can be given to a bleeding episode in progress. It can also be given on regular schedules while at home to prevent bleeding episodes, and some people do receive this continuously. So the clotting factors being replaced can be made from donated blood. So similar products, also known as recombinant clotting factors, can be made in a lab, not from human blood. Also, other treatments include desmopressin. So if you've got mild haemophilia, this is a hormone which can stimulate the body to release more clotting factor. This can be injected slowly into a vein or used as a nasal spray. There's also emicizumab, which is a new drug which doesn't include clotting factors. This can help prevent bleeding episodes in people with haemophilia A. If you've got clot-preventing medications, these are also known as antifibrinolytics, so these can help clots from breaking down. You can also have fibrin sealants, which can be applied directly to the wound sites to promote clotting and healing. So these are very useful for if you're involved in dentistry programs. Physical therapy can ease signs and symptoms if the internal bleeding has damaged your joints, and severe damage can require surgery. You can also have first aid for minor cuts, so using pressure and a bandage will generally take care of the bleeding. For areas of bleeding beneath the skin, small areas, you can use an ice pack. So ice pops can be used to slow down minor bleeding in the mouth. There are different types of haemophilia, of course, type A, type B, etc. But I'll get into that in another video in more detail. That's the end of today's video. Hope you've enjoyed this one. So take care and tune in for the next one. Thank you. Bye bye.